Okay. Josh, so what is the impact of climate change on the healthcare sector, and how can the industry become more resilient?
Well, healthcare is on the front lines of climate change. Doctors, nurses, other healthcare workers, and the hospitals themselves are often the victims of extreme weather events. They're the first responders when something bad happens, whether it's a heat wave or a flood or a drought. Healthcare has to respond. And often our facilities are not prepared. Our hospitals are often prone to flooding or other disasters. And so healthcare has to become more resilient, has to become more climate smart. And what it means to become climate smart is to be able to respond well in an extreme weather event or other climate-created disaster, and it means that we need to implement low-carbon solutions at the same time. So climate-smart healthcare is all about hospitals having their own energy supply that's renewable, low-carbon energy like wind or solar that's off the grid that allows it to operate 24/7 in an extreme event.
Yeah, so next question is, what do you see the biggest challenges of the Chinese healthcare sector, and how the Chinese healthcare sector, and do you think, the Chinese stakeholders, how they can work more effectively together, domestically and internationally?
Well, China has one of the largest healthcare sectors in the world. We just learned today there are 29,000 hospitals in China and more than 1 million health facilities. So the challenge for China is how to do things at scale. So as Chinese healthcare continues to grow and as China invests billions and billions of dollars in improving its healthcare sector, the challenge is how can it do it in a climate smart way? How can it help lead the transition to a low carbon economy through climate smart healthcare? And there's a tremendous opportunity there for China to become a world leader and to demonstrate how healthcare can reduce its carbon footprint, be prepared and resilient in the face of climate change, and be a leading voice for protecting public health from climate change by transitioning to a clean, renewable energies economy.
Thanks. One final question about the artificial intelligence. This is from my personal interest, because lately the Chinese IT giant and also some kind of Silicon Valley IT giant, they put investment into the artificial intelligence in terms of hospital and other health sector deployment. So what do you think their role in terms of reducing the carbon emissions and also reducing the energy consumption?
It's a good question. So as technology evolves and as healthcare evolves, there are increasingly there's a growing menu of low carbon solutions that healthcare can implement. So telemedicine is one example, right? So telemedicine means that people can use internet technology to get diagnosed and to actually visit a physician without traveling to a hospital, without using the resources to get to the hospital, and without using the hospital's resources itself. Similarly, artificial intelligence in medicine can help reduce the carbon footprint of healthcare by applying a set of different approaches to diagnosis and treatment that will reduce the resources, energy resources and financial resources needed to address different problems. So there's a tremendous potential there. There are probably many downsides as well that have not been identified yet. But I think as healthcare evolves into this sort of new technological frontiers, the opportunity to combine those frontiers with the transition to climate smart healthcare is significant.
Great, thank you, Josh.
All right, thank you. All right, cool. That come out.